So again, good afternoon to everyone. We have our course Nursing Pharmacology. It is NPH 000, but in our curriculum, it is NCM 106. I know for a fact that having or studying the concepts of pharmacology is very significant because even you are not in the BSN program, you have already encountered and experienced how to take medications, or should I say, medications have been part of your lives even during childhood or at present, lalo now during the times that we experience the pandemic. So we boost our immune system through multivitamins. We have boosted ourselves with the vaccines that we receive. So these are the measures on how pharmacology is very significant in our lives. And one of the major roles and functions of nurses is administration of medication. And it is also based from the World Health Organization that one of the priority of patient safety is on medication administration, because the higher percentage of the medical errors that have been committed by the healthcare personnel is on medication errors. And for us nurses, it may not be considered as an excuse to have medication errors because it will risk lives. Because drugs may lead to toxic effect. Drugs may cause immediate fatality. Drugs may also lead to complications to patients if it is not merely if not merely considered po yung competencies. Second, if it will not consider po yung policies on how you administer those drugs. So basic knowledge on the acquisition of the skills, the knowledge, and the attitude. Every time that we conduct our class, we always start po with a prayer, because it is very important for us to consider that embracing the spirit of optimum health stamina in an online class. This is a prayer. That's why it's Central Lino RN prayer, because we are already claiming that you will be registered nurses someday. You must have the RN mindset that you will be registered nurses someday as you finish and earn the BSN degree. And altogether, our Almighty Creator, we praise and glorify your name. We humbly submit ourselves on your vital intention to claim the Centralino RN. Help us to attain the optimum health at all times with perseverance in leading to our RN goals. Nurture us with your spirit to keep our open mind, to absorb and retain the lectures and skills concepts according to the nurse licensure examination framework. Let us decide to complete uh, every examination according to your will with prudence and integrity. We appreciate you on our existence to contribute our Centralino RN 100% through teamwork. As we leave ourselves to you on our journey with the core objectives of the MCU College of Nursing, Amen. May you bring your spirit to the hearts and minds of our students of N25. Let them sustain the stamina, the energy that they may need as we and as they uh, join us in our synchronous session for the NCM 106 Pharmacology. So, let us now proceed. Actually, every time that we start our classes in our scheme of works, we always take into consideration learning outcomes, because it will give us a direction on how we will consider the point of the topics that will be reinforced in your skills laboratory and the topics that can be reinforced to your clinical. However, you are already taking your course now in skills laboratory. That's why the topics have been divided to skills laboratory, which will focus on procedures and computations, while the basic concepts of pharmacology are integrated in the lecture part. Even though I may not be part of the skills laboratory, but we have already aligned what are the competencies that are needed to consider in the psychomotor, which is the skills laboratory and the uh, clinical aspect. Okay? As the learning outcomes at the end of the topic and given relevant or actual simulated situations or conditions, the students will be able to first have number one. Number one po, explain the meaning of pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. So if you will notice, the verb that we have used here is already explained. It is not on the lower thinkings lower thinking skills of just discuss or just identify. Explaining meaning even in your own understanding and perception, you can best explain the basic concepts of these three: pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. From the term itself, pharmaco, it is dealing with drugs. It is dealing with medications, and what differs lang with this term is therapeutic, kinetics, and dynamics. If we talk about pharmacotherapeutics, obviously we're talking about drugs, and the therapeutic itself is directed on the desired effect of the drug. Indication per se. If you have heard about if you have watched commercials on supplements, multivitamins, di ba it is flashed at the end, no approved therapeutic claims. Meaning, if there will be a phrase or statement that will consider no approved therapeutic claims, it means that the drug is not indicated for treatment of diseases or disorder. Okay? So meaning, if you will encounter therapeutic, what is therapeutic? What is indicated? What is the desired effect of the drug? Example, if you will encounter a generic name of a drug such as paracetamol, so you are familiar with paracetamol because this is an over-the-counter drug. So paracetamol po, I know that even during your childhood, you have received paracetamol during the time that you experience fever or febrile conditions. So meaning paracetamol is used for fever. Paracetamol is also used as analgesic. So analgesic meaning it is used also for pain relief. So what we're talking about with pharmacotherapeutics, the drugs and indication and the desired effect is basically identified. So paracetamol for fever, paracetamol for pain. Another example is we have carbocysteine, yung mga familiar na drug sa inyo. Carbocysteine is used for the problems pertaining to respiratory function, specifically for cough. So, the classification of carbocysteine, generic name, is mucolytic. If you will encounter classification of drugs ending in lytic, ibig sabihin, it inhibits. So, sir, can you give me other examples na may lytic? Anxiolytic. It means if we consider lytic, it prevents anxiety. Mucolytic. Lytic meaning it inhibits muco. And what is muco? Mucous secretions. So that's why carbocysteine is a mucolytic, and this is indicated for individuals who are experiencing cough. Cough referring to productive cough. And that productive cough is referring to production of mucus secretion. Mucus secretions may cause obstruction. That's why nga it stimulates coughing reflex. But somehow, it may cause harm. It will continuously produce yung mucus secretion because it may start infection. Second, it may cause obstruction. Third, it may cause aspiration towards the lower respiratory tract and may cause obstruction of small airway passages. So that's why the carbocysteine, its indication is to inhibit or prevent production of mucus secretions because it may lead to the three effect that I have mentioned. It may cause obstruction, it may cause infection, and it may cause aspiration to the lower respiratory tract, specifically the small airway passages. Another example that we consider for pharmacotherapeutics are, for example, amoxicillin. For example, you are familiar with amoxicillin as antimicrobial, antibacterial. That's why during your summer, it already introduced to you the concept of microbiology and parasitology. Do you know po that antibiotics could be appropriate if situation goes that you have results of culture and sensitivity tests? We all know that bacteria or microorganism could be gram-negative or gram-positive. So what do you mean, sir? There are some antibiotics that is only intended for gram-negative, and there are antibiotics that are only intended for gram-positive. And there are some antibiotics that are intended for gram-negative and gram-positive bacteria. And those are broad-spectrum antibiotics. These are pharmacotherapeutics. In pharmacotherapeutics also, we will study about drug interactions and adverse, it's only drug interactions. Drug interactions meaning we will study about drugs that will counteract effect if it is mixed with food, with drinks, or with other drugs. Example, in pharmacotherapeutics po class, never take an antibacterial with milk products. Some of you may complain of antibiotics and may not continue to take because of problem of the taste of the drug. What you will do is you will divert it using and mixing it with milk simultaneously. Do you know that milk products will decrease absorption of antibiotics? That's one. So that is one that we are studying in pharmacotherapeutics. Another example, there are drugs that once you mix it or combine it or even simultaneously take it, if you are taking high acidic fruit juices. What do you mean by high acidic fruit juices? Hindi ito yung mga yung commercially na powder kasi mas mataas ang sugar noon. Pero for mga should we say high concentrated or high acidic fruit juices, ito yung mga talagang pure blended fruit juices. So, ang problem with that is that of high acidic, ano ang status ng stomach natin? 'Di ba acidic din ang stomach because of the hydrochloric acid. If you will consider po of taking the drug, tapos you will drink pa high acidic fruit juices, tapos pagpasok pa niya sa stomach, may hydrochloric acid, can you imagine the gastric irritation it will cause to the stomach? Other than that, what will happen po class is that of once you will mix it with the hydrochloric acid and at the same time with high acidic fruit juices, it may cause premature breakdown of the drug, mababawasan yung concentration of drug, hindi po siya ma-absorb yung 100% of the chemical properties of drug. So that's the problem. So let us be aware of these concerns and we will explore it on what is pharmacotherapeutics. Next, we will continue po on pharmacokinetics. Kinetics. If we are talking about kinetics, we are talking about movement. Okay? For the movement po, just remember the mnemonic ADME. Absorption, letter A. Letter D, distribution. Letter M, metabolism. And letter E, excretion. So, class, at the time that you take the drug, for example, per orem or per oral, when you take the drug per orem, it already starts absorption. But eventually, class, if you take the drug per orem, it will direct going to the stomach. And once it proceeds to the stomach, it will be acted upon by the hydrochloric acid in the stomach, will break the drug so that it will be absorbed towards the intestinal tract or the gut. If it will be absorbed in the intestinal tract, the next is the liver will be the one to metabolize the drug. Why it will need to metabolize the drug? All of us po, class, may have different response sa drug. Why is it that others experiences allergic reaction? Why I'm not experiencing allergic reaction to drugs? Why others are experiencing gastric discomfort to drugs? Why the others are not experiencing gastric discomforts or irritations to drugs? Because each one of us may have different physiologic response and reactions to drugs. Moreover, if the person is having a pre-existing illness, example, I have pre-existing illness of peptic ulcer. So will this affect the absorption of the drug? Definitely yes. Because if there is peptic ulcer, it may alter the absorption due to the hydrochloric acid, due to the concern when it comes to the function of cells that will consider po the absorption of the drug to the intestinal tract. That matters. Another, if the person is having a problem with liver, class, we all know that once, for example, taken orally, it goes to the stomach, it goes to the intestinal tract, class, it will metabolize to identify what is the appropriate level or chemical properties that will be needed by the body. And all of us, I know you will agree with me, may have different response on this. Because even the same dosage of drug that we may receive, but each one of us may have different response on the drug. The liver is responsible to metabolize the drug so that to facilitate the appropriate chemical properties, volume, or amount of drug that will circulate to the body. And those that are in excess of the composition and may not be needed by the body, it will process through excretion. That's why nape-prevent po yung toxic effect of drug. So, it processed through excretion. It could be, it can pass through or excreted via urine, or it can pass through via liver to the hepatobiliary tract as bile to the stomach. A typical example is that of when a person is taking rifampicin. Rifampicin is an anti-tuberculosis drug. And usually, nai-excrete po ang rifampicin via hepatobiliary tract. And the effect of this is that of nagkukos siya ng discoloration sa feces. Second, if you are taking iron-based drug, ano yung iron-based drug? Mga ferrosulfate, ang cherry-per ba may iron? I think so. So doon sa drug na ito, if you will observe, magkukos siya ng discoloration sa feces or sa stool kasi yun yung route of excretion niya. For the multivitamins, if you're taking Enerbonsi, Centrum, you will, those are brand names. If you will observe, is there any discoloration in your urine from the usual color? If you took multivitamins, yes. If you will notice, nagkakos ng bright yellow. Yung bright yellow na yon is an indication that the liver metabolize the excess vitamins or minerals of the composition of the drug, and it passed through the excretion via urine. That's the point. I-connect na lang natin with alcohol. For those who are drinking alcohol, if you observe, if for example, if initially nakaka-1 bottle ka of a beer, what happens is that mas frequent ang urination mo. Di ba? Mas frequent because the liver is acting upon to detoxify level of alcohol that is not therapeutic to the body. So if the liver identifies that it exceeds the level of alcohol you are taking, the liver will metabolize it and excrete via urine. Okay? Next, if you go on with the drinking, the more you drink yung volume ng alcohol, the chances po, if you observe, mas nagiging less na po yung frequency ng urination. Why? It's because the alcohol itself may have an effect to slow down response of liver cells. So kung mababa ang action ng liver cells, mabagal din ang metabolic response ng liver. Mabagal din ang pag-excrete ng alcohol. So what happens? Nag-i-stay ang alcohol sa blood. Pag nag-stay ang alcohol sa blood at hindi yan naiihi because the liver cells are acting slowly to metabolize it, sasama yan sa blood. Pag sumama yan sa blood, pupunta yan sa brain. Pagpunta ngayon sa brain, what happens? Pag nagpunta yan sa brain, do you know that the alcohol may cause constriction of the blood vessels? Pag nag-cause ng constriction sa blood vessel, di ba yung immediate constriction ng blood vessel, yun pa lang nagkokos na ng headache. Tapos, pag nag-constrict ang blood vessels, nadidelay ang blood flow sa brain. Pag nadidelay ang blood flow sa brain at mas mataas ang alcohol level, what happens? Naapektuhan na yung alertness ninyo. The alcohol will cause drowsiness na. Nahihilo na kayo, di ba? So dun yung point wherein that's an indication that the brain is already deprived from the oxygenation from blood supply. So what happens now kung kayo po ay inaantok na, brought about by the problem with alcohol, don't push yourself to wake up. You must consider yung point that you sleep na and rest because your brain will regain circulation. Ang problem dyan, pag ikaw po ay you keep yourselves drinking alcohol at alam mo na that you are experiencing drowsiness, what happens is, nagkakaroon kayo ng hangover kinabukasan. Why you are experiencing hangover kinabukasan? It's because your brain and blood vessels are keep on working para ma-sustain yung circulation. Imagine niyo yon, naka-constrict yung blood vessels ninyo because of too much alcohol. Tapos yung liver mo ang bagal mag-metabolize. So hindi ka naman siguro umiihi at magigising if you are under the influence of alcohol. Most of the time you will continue to sleep. If you will continue to sleep and it will retain yung alcohol, increased alcohol level in the blood, it will continue to circulate yung alcohol sa body ninyo. Pag nag-continue mag-circulate yung alcohol sa body ninyo, it will continue to constrict the blood vessel. It will continue for the compensation ng brain para ma-continue niya yung circulation at ma-regain ng mga brain cells yung needed nutrients and oxygenation. Kaya pag gising ninyo, there could be instances, ang sakit-sakit ng ulo ninyo because that's the time wherein it causes tension to the blood vessel brought about by the alcohol because your brain may need circulation. So that's why in those situations po, if you notice sa simula yung frequent ang urination ninyo but as it goes on, nagiging less frequent na yung urination ninyo kasi tumataas na po, that means tumataas na ang alcohol level sa circulation ninyo. And you need to take into consideration how you will balance it. Sir, why is it that the coffee could be the one? Why yung coffee po ang pwedeng mag-cause ng participation para mabalanse yung alcohol? It's for the purpose na ang caffeine kasi sympathetic. Yung sympathetic response niya, nagre-release ng adrenaline. At pag nag-release ng adrenaline, it will cause sympathetic response, fight or flight. Di syempre magigising ka. Why is it? Kasi yung heart mo magpapump ng magpapump. Eh di ba, kung mataas yung alcohol at nagko-constrict yung blood vessels mo, yung heart mo ang nagbibigay ngayon ng enough volume papunta sa brain. Kaya that's why it regain alertness pag kayo ay nag-coffee. Because the caffeine itself releases adrenaline at yung cardiac output coming from the heart because of the adrenaline is the one that supplies the brain with oxygenation. That keeps you awake again. So yun yung mga situations on how these principles are being connected in pharmacokinetics. This is somehow a principle by which how the drug is being absorbed. Remember class, from the time of absorption, for example, if the drug is taken orally, magpipik yung concentration level ng drug pag nag-reach siya sa plasma. Kaya if you will compare kung alin ang mas mabilis na effect ng drug, if it is given intravenous or if it is given oral, much alin dun sa dalawa na ang drug ay makaka-reach agad in a shorter period of time sa plasma? I know you will agree, all of you will agree, intravenous. Kasi pagpasok sa blood, direct na ay pagpasok sa blood vessel, direct na sa blood at nandun yung plasma. Pag nag-reach sa plasma yan, that means the drug will start its peak concentration level. Ibig sabihin, the drug will start to have its effect. Unlike for oral, imaginein mo, papas pa yan sa bibig mo, pupunta pa sa stomach, it will go to the stomach, it will process pa, madidelay pa yung yung process, mag-absorb pa siya sa intestine, tsaka pa lang sa papasok sa circulating blood at plasma. So yung effect ng intravenous nasa drug is 2 to 3 minutes pag intravenous. Compared to oral medication, ang effect niya ay 30 minutes to almost 1.5 hours. Now it gives us the idea, ganun po pala. Connected po pala that the drug will have its effect at peak concentration level will be achieved ay pag ang drug ay nag-reach na po sa plasma. That's it. The more na close siya doon sa plasma, the more na mas mabilis ang effect. Example, substance abuse. Sa substance abuse, di ba mas meron yan tinitake na oral, may tinitake yan na inhalation, may tinitake yan na injectable. If you will notice, mas mabilis yung effect pagka ito ay ini-inhale at injectable. Bakit pag inhale? Alam niyo po kasi pag inhale, direct naman, di ba, ang lungs ay responsible for the responsible for the conversion of unoxygenated blood sa oxygenated blood. So connected siya sa function ng heart, connected siya sa circulation. Kaya mas mabilis ngayon yan from the lungs, direct pumapasok agad sa blood. De lalo na kung for example, kung intravenous din, obviously directed na to sa blood plasma. Pero yung oral, matagal pa yung magi-effect. Kasi magsi-circulate pa siya papuntang stomach sa GUT bago pa siya pumunta ng plasma. So that is merely the concern. If you are an emergency room nurse, it is very rare po to consider na pag may emergency oral medication, it's usually intravenous or inhalation, di ba? Pag may difficulty of breathing, inhalation agad yan. Because the drug could be inhaled, processed to the lungs, and may enter agad to the plasma. Kasi nandun yung capillaries papasok, naka-attach yung capillaries sa alveoli. At pag it will enter the alveoli, it is in contact with blood. And if it is intravenous, obviously, within the blood vessel, it will reach already the plasma. So those are the principles that we may talk later on this. Next, pharmacodynamics. In pharmacodynamics, we will discuss about how the drug is having reaction sa body. We are talking about the biological, the chemical, and the physiologic effect of drug. So dito papasok po yung terms such as side effect and adverse effect. Which of the two can be considered as the normal reaction of drug? So obviously, the side effect. These are the unexpected reactions of drug. Pag sinabi nating unusual reaction, it is not the expected effect of drug. Probably, this is considered as a harmful effect of drug, adverse reactions. Example, I know all of you have been vaccinated. Why you are being monitored after receiving the vaccine? It's because to check if there are unusual reactions. Kung halimbawa after you have received the vaccine and you experience difficulty of breathing, is it an expected effect of the drug? The answer is no. Siyempre ikaw magugulat ka at magwa-wonder ka. I just received the vaccine and yet I'm now experiencing difficulty of breathing. This is not expected because the others did not experience it. Kaya tinatawag nating unusual effect. So that's why pag sinabi nating adverse reactions, these are not the reactions of drug, unexpected reactions of drug. Another, allergic reaction. Ang allergic reaction, it's not a side effect. Definitely ang allergic reaction, adverse reactions yan. Why? Because ibig sabihin the body is increasing its immune system because the drug may cause harm to the patient. Di ba pag may allergic reaction, what happens? Difficulty of breathing. Pag may allergic reaction, what happens? May rashes. Pag may allergic reactions other than rashes, pag nahirapan na siyang huminga, pwede siyang nagko-cause din ng cyanosis or problem probably with oxygenation already. So those are the situations that will alarm the nurses. So that's why pag sinabi po nating pharmacovigilance, from the term itself, vigilant, mapagmatyag in Tagalog, pharmacovigilance is the study of adverse reactions. Kaya po, pagka kayo po ay after being vaccinated, imo-monitor pa po yan after a week, after a year. Kaya that's why po, class, ang vaccines po natin ngayon ay free. Bakit? Kasi it is not yet commercially distributed dahil nasa stage pa lang tayo ng clinical trial 3. What do you mean by clinical trial 3? It is now a trial po for all of us if there will be unusual reactions. And it will take years pa to know if it is already safe. Kaya po ang vaccine po, pag pumasa na po yan sa clinical trial 4, magkakabayad na po yan kasi it is proven safe and certified and recognized na it will be commercially available. So later in our later discussions, we will discuss about what clinical trial is, and I will connect it with the principles and concepts of the vaccines that we have received this past few months and years during pandemic. Next, we will discuss also toxic effect of drugs. We have mentioned about adverse reactions. These are the unusual reactions of the drug. It is not the expected reactions of drugs. These are reactions that may cause harm to the patient. The higher level of adverse reactions, pag severe adverse reactions na yan, at harmful, life-threatening, dangerous to the individual, toxic effect na yan. Always remember, class, that each one of us may only consider a therapeutic level of drug. So for us to know and to identify that if the therapeutic level of drug is still considered po, itetest po yan via serum or blood. Pag lumagpas po sa therapeutic level, ang tawag na po doon ay toxic level. Example, ang drugs such as digoxin ay ginagamit po for a problem with cardiovascular disorder, specifically an antihypertensive drug po ito. Ngayon po, ang therapeutic level po ng digoxin ay 2 nanogram. Pag tinest yan via serum kasi yung patient has an unusual reactions or symptoms, the patient will be tested for the serum drug level. Pag lumagpas sa 2, ibig sabihin the patient is already experiencing toxic level. Pag toxic po, meron dapat mag-counteract sa toxic. Ano ang tawag doon? Do anyone know a drug that is being given to counteract toxic effect of a drug? It starts with letter A. You may type it now in the chat box. What is the drug that counteracts toxic effect of drugs? Now I receive one answer. Okay. So the answer is antidote. Correct. So I would like to acknowledge Miss we have Toreliza. Okay, your answer is correct. Antidote. Just like in a relationship, if it is toxic, how can counteract the toxic relationship? Separate. Yun lang yung antidote doon. Because it may not be healthy. So same as for the drugs. If it will cause toxic effect, kasi alam nyo class, if it will continue to have yung toxic effect, it will damage 2 major organs. What are the 2 major organs that may be harmed? Okay, that may be harmed when it comes to this toxic effect of drugs. Can you identify 2 organs that will be damaged if there will be toxic effect of drugs? You may type in now in the chat box. Okay, type in now, more responses. Okay, So it seems, okay, continue. Continue to have your response. Give me two organs. Give me two organs that will basically be damaged if ever it will continue the toxic effect of the drug. Fallopian tube and ovary. Ano? Just kidding, no. No. Aha. So what are the two? I have seen correct responses. How about the others po? I want to hear from the others po. Sige, good try, good try. Sige, I will explain. What is the two organs that are primarily at risk pag nagkakaroon ng toxic effect ang drug. Kasi usually ito po yung mga sinasabi nating blank toxic ang drugs. Kaya pagka kayo po, pagka nagkokos ng overdose, nagkokos ng underdosage, nagkokos ng abuse, addiction, these are the two organs that are mainly may lead to complication. So, okay. Sige. Ayan. Most of you answered correctly yung isang organ. Some of you have answered correct the two. Correct po yung dalawa. Okay, so I will reveal now the answer. Just continue to post your answers, ha. This is a learning session. So we will just reveal the correct answer. The correct answer is liver and kidney. Okay? So liver liver and kidney po is on the perspective po by which it will consider po dahil alam po natin that the liver is the one responsible for detoxification. And the number two, oh, really? Okay. I just received a message po. From the HR. So on Monday we don't have classes. And November 2 is declared as non-working day. Oh my goodness. Just in. Okay, just in. An advisory, HR advisory number 5. Aside from the October 31, we will not have any classes on November 2. Walang heart, ah. Walang heart. Malungkot yata kayo. Ayun. So November 2, no classes po. So officially po, i-share po natin ito sa chat group. Okay, so long weekend tayo, ha. But anyway, so let us continue. I hope your excitement will boost your neurotransmitters to continue listening and to continue learning from our discussion. Okay. So yun nga po, the liver and the kidneys are the ones that are being damaged whenever there are toxic effect of the drugs. Kaya class, most of the drugs po are hepatotoxic at nephrotoxic. Kaya take care of your health. Take care of your liver and kidney. Once mag-cause na ito ng any damage or you have been diagnosed with any disease or disorder related to the kidney and the liver, the problem is that of you may have problems with drugs. At yung drugs pa possibly ang magli-lead to damage to the liver and kidney. Yung mga yung mga broad spectrum antibiotics, yung mga highly concentrated drugs, these are the ones that may cause the possibility of damage to liver and kidney. Kaya don't do self-medication, ha? Ito naman, if we will try to consider naman yung resistance or drug resistance. Sa drug resistance naman po, when you do self-medications, lalong-lalo na for antimicrobial or antibiotics, if the antibiotic enters the body tapos hindi naman yun yung appropriate drug to target the specific type of infection, your body the antibiotic acts in the body as in the antibiotic that you are taking. Kung magse-self-medicate ka, it is not prescribed by the doctor, pwedeng in the future when you take the drug po, nagkokos na yan ng resistance. Hindi na po yan nagte-take ng effect sa body. and that will cause a problem. Lalo na yan, mga antimicrobial resistance, yan po ang nagiging problem natin as have been surveyed by the World Health Organization. So, take care of your kidneys and your liver and don't do self-medication, okay? Lalo na for the antibiotics or antimicrobial because sooner or later it may cause drug resistance. There will be less effect na of the drug or no effect at all. So if it will lead you to a severe infection, the severe infection is called as sepsis. Tapos you need an antibiotic that is talagang appropriate for the condition mo. That's the problem. It may not anymore have its desired effect. So magkakaroon ka pa specifically ng test of what antibiotics ang pwedeng mag-fit sa condition mo na hindi ka maglilid sa resistance. Next po, the nursing process po will always be part of our responsibilities. It will give us the confidence if we will withhold the drug or not. Most of the antihypertensive drugs obviously must check initially blood pressure because there are situations like when you will take a drug ending in olol, sa generic ha, metoprolol, atenolol, propranolol, yung lahat ng may olol sa huli, ang tawag po dyan ay beta blockers. I will explain this simply. Ang beta po ay the one that transmit impulse para mag-pump at mag-contract ang heart. The more na ma-stimulate po ang beta receptors, the more that it will cause forceful contraction of the heart. A typical example po ay pag nag-release ng adrenaline, magbibigay ng signal, it will give a signal to the beta receptor. The beta receptor will transmit impulse to the heart to contract. Yun nga lang, pag too much ang pag-contract ng heart, it will cause increased consumption of oxygen. Nag-i-increase ang oxygen demand dyan. So now the problem is that of pwedeng mag-cause ng chest pain sa pasyente. Dalawa pwedeng mangyari. Mag-palpitate ang pasyente mo. This is the term that you will feel that your heart is vigorously contracting even though it will not be auscultated. Mararamdaman mo yon, mabilis ang tibok ng puso nyo, and that's palpitation. And palpitation may cause a problem or a complication. To what extent? It may cause the possibility of too much oxygen will be consumed pero walang cardiac output. So walang magsi-circulate sa different parts of the body. So if ever po the patient po will have the olol, ang action niyan, ibablock yung beta receptor, babagal ngayon yung contraction ng heart. It means to the extent of a normal cardiac rhythm. But the problem is that if you will not take the vital signs such as the cardiac rate, if the cardiac rate is below normal and you will administer the drugs such as olol or beta blockers, do you think mas lalong bababa pa yung cardiac rate ng pasyente? The answer is yes. The other risk dyan is that of it will cause the possibility na mag-cardiac arrest ang pasyente mo because it will continuously cause sudden drop of the cardiac function. Will that be a major responsibility of the nurse? Yes. That's why if you will consider po na mababa ang pulse rate, mababa ang blood pressure, mababa ang cardiac rate, mababa meaning below the normal range, then it is your responsibility, your clinical decision making to withhold the drug. You will not anymore wait for the doctor's order because we can execute the withholding of the drug if we are confident with the basis of vital signs. That is very basic. So that is what we call the purpose of having nursing process on hand. Now, discuss safety guidelines for drug administration. I know you have been oriented with the rights of medication. The rights of medication is very important so that to facilitate patient safety because medication errors have been identified as the highest. Almost 60% of medical errors are identified, 34% are identified po sa medication errors on patient identity, wrong drug, wrong administration. So those are the things that will not be considered as an excuse for us to consider, because it will it will cause harm to the patients. Now, calculate dosage of various form of medication. Computations and calculations of drugs will be reinforced in the skills laboratory. However, one thing that I will emphasize when it comes to the calculation of dosages is to prevent underdosage and overdosage. Overdosage may cause toxic effect. Underdosage may not reach the peak plasma concentration and may not cause the effect or the side effect of the drug. So that is both a problem. Huh? Now, can I invite everyone for an interactive discussion? Since I have given an overview about pharmacology, what best define now pharmacology in one word? You may now visit the slido.com and have the code 2224289. So please post your answers so that I may identify if you are already in the process and connected with me with the learning outcomes that we may have for pharmacology. Let's start. Of the 27 students on board, I'm still not seeing responses. It means, ayan, it's now working. So, it's good. It already embedded the ADME. Okay, how about the others po? So we are talking about pharmacology as drugs. We have talked about considered as effect. Okay, yung effect meaning we're talking about side effects or adverse effect as drug reactions. The ADME that we have considered about, the code has been there. We have the A, absorption, D, distribution, M, metabolism, E, excretion. We've talked about antibiotics, somehow related to what we have discussed about antimicrobial resistance. It talks about metabolism because the drug are being metabolized by the liver and excreted by the kidneys or the hepatobiliary tract. It considered also pills. Okay, because this could be a form of drugs, because it could be suspension, powder, tablet, capsules, or pills. And do you know, just an overview, that we have pills such as yung contraceptive pills. We will discuss it in the pharmacotherapeutics of how the oral contraceptives may cause a particular cancer. Oh, and that will be discussed soon. So we have the ADME. Mukhang may nag-post ng AMDE. So baka ma-mislead kayo na mauuna yung absorption tapos metabolism tsaka pa lang siya ma-distribute. So it must be ADME. Okay, ADME. So we have dosage of drug, very essential to identify if the client is underdosage or overdosage. So continue to have your response. So ibig sabihin, the one that has been highlighted here as drugs, meaning that it always, that when we talk about pharmacology, it talks about drugs. Moreover, if I may add, it will consider, if we say pharmacology, obviously it's a study of drugs. But we consider this is a science. Why? Because when we consider the science as a systematized body of knowledge, we're considering on how it was developed, how the drug will be used, how the drug will benefit will benefit individuals, how the drug will process inside the body, how it will be excreted. It's part of science. We've considered also drugs as patient's reaction to drugs. Okay, so drug reaction, that could be drug resistance, that could be drug abuse or drug dependence, drug abuse, addiction. So these are the common terms that could be associated. Patient safety, as one of the advocacy where nurses are considering as a major key role. Drug interactions, we are talking about drugs that will cause a possible counteraction to the system of the body. So thank you so much for your inputs when it comes to what best define pharmacology in one word. And it revealed we are talking about drugs. Now, we will proceed to the definition. The definition of the pharmacology is simply considering the science of drugs. And we are talking about pharmacology of studying the preparation, the properties, uses, and actions of drugs. You might definitely encounter that drugs are being tested primarily on laboratory animals before it will be tested to humans. That is what we call clinical trials. We're also studying drugs pertaining on its sources, on its origin. The study of drugs on the origin or source of how the drug had been developed is pharmacognosy. Sa pharmacovigilance is the study of adverse reactions, while in pharmacognosy, it study about the origin of the drug. Do you know, class? It is just recently I was invited by the East Avenue Medical Center. There's already pala Philippine Society of Nurse Toxicologists. Sooner or later, this could be a specialization of a nurse. The role of a nurse toxicologist is to study about poisoning and adverse reactions of drugs or toxic effect of drugs. Very interesting, right? Because it will expand your competencies on how to become vigilant when it comes to the effect of drugs when it reach adverse reactions or toxic effects. So it's good. So sooner or later, for some of you will be nurse toxicologists, you are on your way with your interests, with your capacity and competencies. Soon, you could be you could have the specialization on nurse toxicologist. So in this perspective, we are also studying the toxic effect of the drug, which we have mentioned that we will also understand that it will counteract with antidote. So these are the definitions of the pharmacology. And as a review of what pharmacokinetics, pharmacodynamics, pharmacogenomics, and pharmacotherapeutic is, if we say pharmacokinetics, we are referring to movement. And that we entail about ADME. When the drug enters the body, the drug directly proceed to plasma. It means that's absorption. In distribution, when the drug is already in the plasma and will proceed to the different compartments of the body, that's distribution. For the metabolism, the drug will be metabolized by the liver. And for the excretion, it is on removing the properties of drugs that may not be anymore useful to the body. So, kaya nga po ang multivitamins po, class, have been called a supplement because it will just support what is lacking in your body. We have also reserved vitamins and minerals in the body. It so happened for those who are engaged into vigorous physical activities, mas sila yung nag-cause ng consumption ng use of vitamins and minerals, yung losses. Kaya for the body, for those who may not be involved in vigorous physical activities, mayroon kayong reserve. Kaya the action of the liver is that of, if it already identifies that you have reserved vitamins and minerals, the excess of that will be excreted by the body. So can you see the mechanism of the action of the liver and the kidney? So if for example, so should we say that, sir, that if there is a problem with the liver and the kidney, the person could be high risk of adverse reaction? The answer is yes. Could be the person high risk for toxic effect? The answer is yes. Okay? So next is we have pharmacodynamics. When we say mechanism, this is on how the body, or rather the drug, will have reaction accordingly through the chemical change, biological change, or physiologic change. So that's why, or physiologic reactions. So that's why we associate this with side effect or adverse reactions. Pharmacogenomics. So pharmacogenomics po, class, we have considered here that each one of us may have or may vary effect of drugs. But somehow with research findings, it can cluster po what is effect for male and female. That's why in drug literatures of drug, if you will purchase a drug that may box siya, kunin niyo yung paper inside. Yun yung drug literature. It will very helpful for you to gain the basic information of the drug because it will give you information about indication. So pag sinabi natin indication, what is the purpose of the drug, why the patient is taking the drug, what case can consider this drug. That's the what we call indication. Contraindication, that's the case wherein drugs must not be given to those cases. Contraindication. Side effect, your role is to explain to the client that the patient will experience this as a normal reaction of the drug. Adverse reaction is the unexpected or harmful reaction of the drug which will alarm you so that to test if the patient is already leading to toxic effect. So alarming yon. So that's why you have a role in that to prevent the complications. So what I'm talking about is that of male and female varies hormone, diba? Hormonal level. And hormonal level class will consider po basically on this action. So for example, just like for the female, ang female po may testosterone. Pero pag nag-take ng testosterone supplement ang female, mas nagiging ano siya, mas nag-i-increase ang hair growth niya. Kasi for male, mataas kasi ang testosterone, kaya mas mataas ang hair growth. So compared to female, mas less ang hair growth. So pag nag-testosterone supplement po ang female, nagkokos siya ng same effect of the testosterone level for male. For the male naman who's taking progesterone or hormonal supplements such as progesterone, nagkokos naman siya ng enlargement of the breast, which basically the high level of hormones for female. So talagang meron siyang effect on this. Another pharmacogenomics is referring to if there are inherited cases or health conditions that will cause an effect sa what you call this, what will cause an effect sa condition. Kaya pag 'di ba sa vaccines, you are being asked, meron po ba siyang pre-existing illness? Meron po siyang bang comorbidity? Kasi wala pang study during the early times po that we are implementing vaccination. Wala pang study if it will cause what you call this, it will cause an adverse effect sa may mga comorbidity. Pero sila kasi yung prioritize because there is already a study that concludes it is safe for those with comorbidity or pre-existing illnesses. Number 4 is about pharmacotherapeutics. For pharmacotherapeutics, it means it already achieved the maximum level of the drug, the maximum effect of the drug. Okay? So now is the time for the 27 students here, N25, I hope you will have the maximum participation because this will be another interactive discussion. So I will be presenting to you a question that had been retrieved from international exam references or local board references, which may basically help you on how to use your analytical and critical thinking. Let's start. First question. The nurse who is caring for a client explains the movement of drugs into, through, and out of the body. This refers to pharmacokinetics, pharmacodynamics, pharmacognosy, or pharmacotherapeutics. You may post your answers in the chat box, hoping to reach 27 of participation. Again, the nurse who is caring for a client explains the movement of drug into, through, and out of the body. Is it pharmacokinetics, pharmacodynamics, pharmacognosy, or pharmacotherapeutics? We are 28 on board. I am expecting 27 will participate. The section, actually, I admire the other sections such as the section 4 because they always have the maximum number of participants whenever we do self-assessment exercise. So hoping also in this section, you can have your maximum participation because I will admire and I will appreciate if everyone will participate in this interactive activity. So we have 15. So what happened to the other 6, 7, 8? What are the where are the others? Okay, 20. So we just need the 6. 6. Okay, so 21, 21, 22. Okay, we need the other, okay, we need the other 4, I think. The other 4, hoping you can still respond with your answers. 23 out of the 27 of our students here. So I will just check your responses. Aha. Okay. Aha. It seems majority of responses goes with, let us now reveal, letter A, pharmacokinetics. Even though the ad may have not been indicated in the question, but the term itself of movement already guided you of pharmacokinetics into, through, and out of the body. Kasi into, absorption, through is the distribution and metabolism, out of the body is excretion. Even though it did not use those terms, but the simplified terms had been used to facilitate, to best define letter A, or pharmacokinetics. We have defined letter C as pharmacognosy, as the study of the origin of drugs. Next question. Pharmacokinetics can be simply described the study of what the body does to the drug, except we are looking for a wrong statement. Is it the rate and extent to which drugs are absorbed into the body and distributed to the body tissues? Is it referring to the rate and pathways by which drugs are eliminated from the body by metabolism and excretion? Letter C, is it the relationship between the time and plasma of drug concentration? Or letter D, is it the drug produces biochemical and physiologic changes in the body? Which of the following statements, following statements is not the correct statement referring to pharmacokinetics? We are now receiving 1 out of 27, hoping the others will post their answers. So now we have 3. Okay, which of the following? Let's have a trial. Just have an assumption that you have encountered these questions when you are taking the board exam. When you take the nurse licensure, examination, um, you may not expect exact construction of the questions. It may consider po uh, on the concern related to these definitions. Okay, so we have 16. Just continue your response. Okay, we have now 22. Okay, good turnout. Okay, we have 23. Where are the others? We are now 29 in the loop. So merong na-add po sa ating pong group. We are now 24. Okay, so let's see. I will just check your responses. Uh-huh. Mm-hmm. Mm-hmm. So let's see. Majority of the answers may be similar to the correct, but majority, as what I have checked, have the answer on letter D. Okay. Why letter D is except? Letter D is the drug produces biochemical and physiologic changes in the body. Okay. The point here is that of the biochemical and physiologic changes in the body is not pharmacokinetics. It is referring to pharmacodynamics. Okay? Di ba, I emphasize to you yung mechanism. Pag if we say mechanism, it already considers po the chemical, biochemical, and physiologic changes because it talks about yung result ng side effect at saka adverse reactions. So, letter A is a correct statement because it consider absorption and distribution. Letter B is a correct statement because it consider metabolism and excretion. Letter C is correct because absorption is defined that reach to the plasma, and the plasma is associated with the principles of effect and time. Okay? So hoping all of you have been enlightened that letter D is the answer. Next question. Next question. The nurse is aware that the maximum use of drugs to treat specific disease or produce a desired effect. Again, the nurse is aware that the maximum use of drugs to treat a specific disease or produce desired effect. Is it referring to pharmacokinetics? Is it referring to pharmacodynamics? Is it pharmacogenomics or pharmacotherapeutics? The nurse is aware that the maximum use of drugs to treat a specific disease or produce a desired effect. As a guide, please capture or consider po yung terms that will guide you from those questions. I know those questions, it can guide you dito ha, as a tip. Maximum, desired effect, treatment. So yun ha, I already gave you the tip or the terms that will guide you on your answers. So I have already 9 responses, hoping everyone will have the maximum response po. 13, 14, 15, okay, 16, 18, 19, 20. Okay, how about the other 7? So na mukhang it seems the other one had been connected because we are 29. Don't you worry, after the self-assessment exercise, we'll have a health break because you deserve a health break after a long, almost 1.5 hour of our discussion. So 22, how about the other 5? Okay, 3. 3, please try to participate po because it will really help you. Okay? So let us rebuild. So I'll just check your responses. It seems responses are nag-vary. Class, maximum, treatment, desired effect. Pag sinabi nating desired effect, what is the indication of the drug? How it is used for treatment? So that is referring to letter D, pharmacotherapeutics. Because if we say therapeutic, we are talking about desired effect, used for treatment, maximum effect of the drug. Next, we have the nurse noted a harmful. Ayan tayo ha. Guided po tayo. The nurse noted a harmful unintended reaction of the drug, which refers to desired effect, adverse effect, toxic effect, side effect. Which of the following has been noted as a term referring to harmful unintended reaction of the drug? We have already 3 responses, and post your answers in the chat box. Okay, 17 responses, 19, 20. Haha, it seems everyone knows the correct answer. We are now 23, 23. 23. How about the others? 24. So we need the other 3. Hoping we could reach 27, at least the maximum. Okay, I'm challenging everyone to reach the maximum. 24. Okay, so it seems the others are not posting their answers na po. So let's see. The answer is adverse effect. I'll just check those responses. Aha! The others, remember class ha, For those who have answered side effect, harmful. Harmful. So, ibig sabihin, the term itself harmful, hindi siya yung intended. Okay? Unintended na nga siya. So, yung higher level po kasi of harm at life-threatening na siya, that answers letter C, toxic effect. Yung desired effect naman, ito naman yung therapeutic effect of the drug. What's the indication of the drug for treatment? Okay? So, next question. Next question is, the nurse notifies the physician due to a serious adverse effect that occurs when plasma concentration of the drug reaches, again, the nurse notifies the physician due to a serious adverse effect that occurs when plasma concentration of the drug reaches dangerous and life-threatening level. May sagot na agad, wala pang choices. Pero I admire, ha? Sige, tingnan natin. Is it side effect? Is it adverse effect? Is it toxic effect? Or is it desired effect? The nurse notifies the physician due to a serious adverse effect that occurs when plasma concentration of the drug reaches dangerous and life-threatening level. It could be fatal, it could be a major complication, it could be a damage to organs. So, yan na po yung nagiging effect niya. So, we have 17 responses, hoping the others will also post their response. 21. Okay, so we have 26 now on board. So what happened to the other one? She or he had been disconnected already. So 23, so we lack 2. Okay, 24. So we lack 1. Who is the other one who's not responding? Okay, very good. So let's see. I'll check your responses. I'm always taking note of your responses. Okay. Okay. It seems everyone have unified responses. The answer is toxic effect because we have considered that this is already dangerous and life-threatening. Next question. Next question, the nurse emphasized in her health teachings on the reduction of effectiveness of medication in treating a disease or condition that refers to drug tolerance, drug resistance, drug dependence, or drug abuse. So a while ago, I set an example when you do self-medication. This is the one that possibly may experience by the person. This may have already a decrease in the effect of the drug or somehow totally may not act on the body. So have your response. We have six responses already. Okay, 9, 10, 11, 12. Okay, continue to post your answers. 13. 16, 17, 18, 20, 21, 22, 23, 24. Okay, so I think the other one already registered again. So we have 24. We need the other 2 to reach 26, at least to the maximum. So I'll just check your response. So while waiting for the other 2. So, okay. Okay. Remember the example that I set a while ago about antibiotics? The answer is, nagdi-decrease yung effect ng drug resistance. So, ibig sabihin resistant na siya. The person is experiencing drug resistance if there is already reduction in effectiveness of medication in treating the disease. Ang drug tolerance naman, it refers to a possibility that the person cannot tolerate a certain dose. So there are instances that it will either increase the dose or the loading dose so that to facilitate yung physiologic effect sa body. So yun naman ang drug tolerance. Kaya may mga instances po sa inyo class na a person cannot tolerate paracetamol for pain relief, cannot tolerate ibuprofen for pain relief. Pero ang pinaka nagkakapag-pain relief sa inyo ay tramadol. So that's what you call drug tolerance. May mga situations naman that the patient cannot tolerate 500 milligrams. So the patient can tolerate 100 grams. So Yun yung mga situations when we talk about drug tolerance. Yun nga lang, sometimes the patient, if too much reliant na siya sa drugs at hindi na siya nagpa-practice ng non-pharmacological management, kasi ang pain can be managed naman yan ng deep breathing exercise, activities, diversional activities, turning or mobility. Yan po yung pwedeng mag-lead into pain management. Pero if the patient will not anymore think of any of these measures to have pain relief at siya po ay naka-rely na lang sa drug such as, for example, this pain reliever, drug dependence po doon. Ngayon, if the patient is not even experiencing pain at nagtitake pa siya ng gamot na yon because it satisfies yung kanyang mind pagdating dun sa effect ng drug abuse na po yon. At pag nagkaroon na po yan ng mga mental, emotional, behavioral effect, papasok na po si drug addiction. Okay, next question before we proceed with our health break. The nurse assists the client after taking the medications on the expected physiologic response that is unrelated to the desired action of the drug. Again, the nurse assists the client after taking the medication on the expected physiologic response of the drug. Answer, is it toxic effect? Is it adverse effect? Is it side effect? Or is it desired effect? The nurse assists the client after taking the medications on the expected physiologic response that is unrelated to the desired action of the drug. Is it toxic effect? Is it adverse effect? Is it side effect? Or desired effect? So we have 4 responses in the chat box. 4 responses in the chat box. So let's see. How about the others? How about the others po? Okay, we are now 22, 24. So, now we are now 28 again in the loop. So we have to achieve 27. Okay, we lack 1. We lack 1. So probably the others, ayan, 27. Very good. I really appreciate that you have achieved the maximum participation. So the answer, Lyle, naging 28. So ibig sabihin may 2 gadgets ha. Okay, let's see. Okay, yan. So most of the answers are unified naman. The answer is side effect. Kasi what will guide you is expected from the unexpected. The one that causes harm is adverse effect. Yung higher level, toxic effect. Although it is mentioned here, adverse physiologic response that is unrelated to desired action kasi may mga situations na yung reaction niya ay side effect pero tentative lang siya. So nagiging adverse reactions na yan pag napoprolong na. Kaya yun yung time na pag ang doctor nag-shift na or nag-change na ng mga generic drugs or other brand name ng drugs. Okay? So next question po. The nurse understand, ito na yung mga concern. May mga questions po in the board exam na simply may really test your comprehension. Okay? Yung skills nyo sa comprehension. And you may need to balance po yung time management every time that you will answer questions. So the nurse understands that the ability when the client endure ordinarily injurious amounts of a drug or the lowering of the effect obtained from an established dose that requires raising the dose to possibly toxic level to maintain the same effect. Ganito yan, ma. Ito yung minention ko sa inyo kanina that the person cannot, pag ginamit ko yung term, malalaman nyo na eh. The person cannot manage on a certain brand. The person cannot manage on a certain dose of drug. So, may mga different response tayo sa body eh. That's why the patient may take 500 milligrams, the other can manage 1 gram, the other one can manage only paracetamol, but the others can manage the other type of analgesic or for pain relief. So, please type your answers in the chat box. We have already 8 responses. Continue. 11. Okay, let us continue. 11 responses, 13, 14, 14 responses, 15. Okay, 16. So, we are waiting for the others po. We're waiting for the others po. 22. Okay, 23. Okay, we have 24. So hoping the others will follow, we still need 2 responses. So hoping the other 2 may, oh yeah, 25. So we need another one response so that it may complete. So, but anyway, let us, I'll just check your responses. So taking into account your responses. Okay. So majority of you have responded and the answer is drug tolerance. Yan. So it means that even though injurious amounts na siya, 1 gram, kaso yun yung nag-a-attain ng satisfaction eh. Ang problem doon, if the patient will consider na nag-a-attain na siya ng satisfaction sa ganun, yun na yung mindset ng patient psychologically that satisfies him or her on the situation of taking the drug on a higher dose. Doon na siya nagiging drug dependent. Kaya iniiwasan natin yung ganung situation. That's why a nurse must also emphasize mga non-pharmacological management other than pharmacological management. Next question. The nurse observes the client on the physical and psychological reliance on chemical agent that may result to continued use, abuse, or addiction. Is this refers to therapeutic effect, drug dependence, is it drug interaction, or drug or desired effect? From the term itself, reliance, the person is already satisfied and relied on these chemical agents or drug na somehow this may lead na nga to higher level of abuse or addiction. So we have 9 responses. Okay. 18. So let's continue. 19, 20. Okay, where are the others po? 2, okay, 22. We have the other 2, 24. So consistent tayo sa 24 pero pag tumaas pa siya, it means the others are continuously responding. 23, 24. Yan. So next, we still need we still need 2. Where are the other 2? 6, 27, please. Have your response. So but anyway, since it had been achieved to almost 26, I'm now checking your responses. So it seems iba-iba ng sagot. But let's see. Since it's all about reliance, you rely. I rely on you. What does it mean? The answer is drug dependence. Okay? If we say drug interaction, this is the effect of the drug that alter. Yan, pag drug interaction, it alters absorption, yung pagka namimix sa drug to other drug, namimix sa other food, yan yun. Kaya yun yung tinatawag natin drug interaction. So, therapeutic effect and desired effect are the same. So, I think we will have to consider na muna po ang health break. So, we will have 20 minutes. Okay, 15 to 20 minutes health break. Let yourselves hydrate po. Let yourselves hydrate. Let yourselves stretch for your extremities, good for your circulation. So we will be back after 20 minutes. Thank you. Just a reminder po, part of our asynchronous session will be the self-assessment exercise. So probably the quiz will be open at 7 o'clock. You can start actually answering it. So while we are having our discussion, supposedly we will end up to 7 o'clock, but we will just extend for another 15 minutes to facilitate the topic or discussion that we decide to discuss for today. But at 7 o'clock, the self-assessment exercise will already be open. Thank you. Okay, so we have already maximized the 20 minutes of our health break, while the others saw me in the 24 oras. Anyway, let us continue with our discussion. Um, I will present to you an audiovisual presentation that will give us an overview about pharmacokinetics. And I may interrupt on some of the discussion to have a simplified explanation on it.
Hi, this tutorial is the first in the pharmacokinetics series. So first of all, I should talk about what pharmacokinetics is. Within pharmacology, we often talk about two distinct, but unfortunately unintuitively named branches. These are pharmacokinetics and pharmacodynamics. Briefly, pharmacodynamics is the study of the effects of drugs on the body. That is, what does this drug do to the body? What receptors does it activate? And what other effects does it have? Alternatively, pharmacokinetics is the study of the effect the body has on drugs. In pharmacokinetics, we ask questions like, how does the drug get into the body and where does it go? What does the body do to the drug? And how does the body get rid of the drug? It is this branch of pharmacology that we will be looking at in this series. So let's begin with a pharmacokinetics acronym you'll find in every textbook of pharmacology. ADME. A-D-M-E. This stands for absorption, which is how the drug gets into the body. Distribution, which is where the drug goes to in the body. Metabolism, which is how the body chemically modifies the drug. And finally, excretion, which is how the body gets rid of the drug. These are four elements we need to consider when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics. But for the remainder of this tutorial, we are going to discuss some of the more boring but incredibly important aspects of pharmacokinetics and pharmacology. So I'll begin by drawing a graph. And here on the y-axis, we have the concentration of drug within the body. And on the x-axis, we have time. So if we give a person a drug at time 0, then we will see the concentration of the drug go up, and then it will fall slowly as the drug is removed from the body. And that's what we see on this graph. So looking at this graph, we can see that in this section, the drug enters the body faster than it is being removed from it. Therefore, the concentration of the drug in the body increases. Then, after the peak of this graph, the drug is being removed from the body faster than it is entering. So the concentration of the drug in the body starts decreasing. This point at the top of the graph is important because it is the highest concentration of drug in the body. Therefore, we call this the maximum concentration, or Cmax. This is important because knowing the maximum concentration can help predict the therapeutic benefit and also the likelihood of side effects. The time at which the maximum concentration occurs is called Tmax. Now, a slightly more confusing concept is the half-life of a drug. The half-life.
Okay, so just to interrupt the audiovisual presentation, if you will notice with this, with the X and Y axis, it facilitates if the drug enters the body, tumataas po yung concentration of drug hanggang dumating siya dun sa plasma. Kasi that's the point wherein once the drug enters the plasma, dun na mag-start yung metabolism. And if you will notice, when it reached dun sa peak concentration level, it will now decrease. Because this is the time that some parts of the drug are being removed out of the body or being excreted. When the drug reaches yung pinaka-peak niya, because that's the indication that it reached already the plasma, that is what we call the peak concentration level or maximum concentration. That is also the consideration that the period of time or the length of time that the drug already reaches the maximum concentration. When we talk about half-life, pag nag-achieve po pala ang drug pagdating dito sa peak concentration, 100% yan. And that is what we call bioavailability, 100%. Now, on this portion po, yung concentration of the drug sa half at yung half ng time that the drug is already reaching the circulation, that is what we call half-life of the drug. Just like for a typical example, the drug is being given for 8 hours interval. The first dose was given 12 noon. So we expect that the next dose will be given at 8 o'clock. So ano ang half-life of the drug? Ang half-life of the drug, pag nag-reach na siya ng 4 o'clock, yun na yung point na yung drug is already 50%. 50% that had been absorbed and the 50% are being removed out of the body. So can you imagine the 50% that are already circulating sa body within the plasma? Kaya the next dose, to make it again 100%, to fill again the 100%, is to give the drug on time at 8 o'clock. Kaya if for example, if the concern is administration of antibiotic, then you miss the dose at 8 o'clock because the drug is not available, because it leaded you to out of focus of the administration of the drug at 8 o'clock, nagbabago yung percentage of the supposedly 50%. So bumababa na sa 50% yung effect ng drug. So dapat the drug must fill again another 50% for the next 4 hours. Kaya it is very important for us to think that the drug must be administered at the right time and the right frequency. So in this perspective, we have considered po yung tinatawag nating half-life. Yung half of the concentration and the half of the time. Half-life drug. Half-life of the drug yon. Okay. Now, as we considered po the pharmacokinetics as the movement of a drug across body membranes to reach its target organ, the 4 stages of drug as mentioned is the ADME. So I will be showing again to you an audiovisual presentation for us to understand if the drug po that are being given intravenous may differ from the drug being given by inhalation and if the drug is being given via oral. Let us now proceed to another audiovisual presentation. Again, these videos that are being played now had been uploaded to Central Linupit staff. You may just proceed to the week 1 and proceed to the supplemental learning videos. So let us start.
Hi, this tutorial is the second in the pharmacokinetics series. And in this video, we're going to have a look at absorption, or more specifically, routes of drug administration. If you haven't seen the previous tutorial, I highly recommend watching it before continuing with this video, as we will use terminology which was introduced and defined in that tutorial. So I'm going to begin by drawing a very simplified body plan. And this body plan follows the flow of blood from the digestive system to the arterial circulation. So let's see how this happens. So blood flows from the gut to the liver via the hepatic portal system. Blood then flows from the liver back through the venous circulation and into the right side of the heart. The blood then flows through the pulmonary arteries to the lungs. Then from the lungs back to the left side of the heart, then out into the aorta and into the arterial circulation. What we are going to do is place drugs into different parts of this system and measure their concentration in the arterial circulation over a period of time. So I'll draw a set of axes, and on the y-axis we have blood concentration of drug.
Okay, so I will just interrupt. If you will notice, let's go back to the principle of your anatomy and physiology. Sa principle of anatomy and physiology, it entails yung how the blood will be processed from oxygenation or non-oxygenated blood to oxygenated blood. However, we start with the gut. It's because when the drug is being given by a GUT, it will pass through the gut, then di ba magpa-first pass effect sa liver, which will be metabolized by the liver, then will transfer to the biliary circulation, which is the vein. So non-oxygenated blood proceed to the right side of the heart, proceed to the lungs via capillaries, then becomes oxygenated, proceed to the left side of the heart, and it goes to the aorta, to the systemic circulation. This is the time that the drug will have its distribution kasi kailangan ang drug mag-reach doon sa oxygenated blood papuntang systemic circulation at i-carry na siya ng plasma. Kaya later on, if you will observe, if the drug will be given in the lungs, mas lesser na yung pathway niya papuntang systemic circulation. But if it will start with the gut or from the oral, it will pass through the liver pa, vein, right side of the heart, the lungs, the left side of the heart, papuntang artery. So kung vein naman siya, it will not pass through the liver again for first pass effect kasi puproceed na siya sa circulation papuntang right side of the heart, lungs, left side of the heart, and artery. So the more closer po yung pathway, the greater chance po na mas mabilis ang effect of the drug. That's why, kung for example sa lungs, sa mga anesthesia, general anesthesia, di ba mabilis yung effect of the drug kasi nagkakos na siya ng direct diffusion papunta ng circulation going to the left side of the heart, which is oxygenated blood. So it matters po, ang tatandaan po natin, the drug will start its distribution or a next phase if the drug will reach the plasma of oxygenated blood. Okay? So let us continue.
And on the x-axis, we have time. We'll begin with the most common route of drug administration, which is orally. These drugs move through the digestive system and get absorbed by the gut. Then they move through this whole system, that is, the liver, the venous circulation, the heart, the lungs, back to the heart, and then to the arterial circulation. This takes quite some time, so what we see is a slow rise in the blood concentration and then a slow fall. Note that the Cmax is quite low and the Tmax is quite large. We'll now contrast that with intravenous administration. Assume that we give the same dose of the drug intravenously, and for those who have read ahead, this drug does not undergo first-pass metabolism. In intravenous or IV administration, the drug doesn't have quite such a long journey to reach the arterial circulation, as it only has to go to the heart, the lungs, back to the heart, and then to the arteries. This results in a quicker rise of drug concentration, which might look something like this on the graph. Note that the Cmax is larger and the Tmax is smaller, even though the dose was the same. This is because IV is a more direct route of administration than orally. Now contrast this with inhalation of a drug. Let's again assume that we have given the same dose of the drug as the last two examples, but this time we are giving it as an inhaled form. Many anesthetics are actually given this way. The drug now only has to go to the heart and then straight on to the arterial circulation. This means we will see the concentration of the drug shoot up very quickly. So note the much larger Cmax and the even smaller Tmax via this route of administration. Also, remember that in all these three examples, the dose of the drug was identical, only the route of administration changed. So you can see how different routes may cause a...
Okay, so I hope you have a more and clear understanding. From this X and Y axis, if you will notice, mas shorter yung time na nag-reach siya at mas mataas yung peak concentration level. Ibig sabihin, mas pag nag-reach siya agad sa peak concentration level, mas mabilis yung effect of drug. This is an example of this, number 3. Kasi from the lungs, malapit na siya sa systemic circulation. Yung number 2, which is the intravenous, mas mabagal compared to the inhalation kasi it will pass through pa from the right, the lungs, the left, and to the systemic circulation. Moreover, lalo na pag oral. So pag oral, mas malayo yung pathway niya. Kaya ang baba po nung ibig sabihin mas mahaba yung time, mas matagal pa siya mag-reach sa mismong peak concentration level. Hoping this has given you the perspective of why we need to understand na why in emergency situation it's either inhalation or intravenous yung route po of administration. Okay? So now in this situation po, the 4 stages of drug movement considers absorption. So from administration site, going across tissues, then systemic circulation. Now, there will be a degree and rate of drug absorption. So, it may depend on the administration route. Tulad kanina sa audiovisual presentation natin, it starts with the administration site. Kung oral siya, from intravenous siya, and from the inhalation siya, it matters talaga yung rate and time of effect. For the patient's age, our concern here is that of the more na yung elder yung individuals, the chance po that mas low ang metabolic response. That's why most of the elders po are high risk of adverse reactions because they are the ones na mabagal ang response. Kaya pagka ang liver mo nagde-detect na siya ng toxic effect, mas less ngayon mas slow yung reactions, kaya mas high risk naman, nagiging vulnerable. Kaya we always consider ang most vulnerable po talaga when it comes to drug reactions, toxic effect, diseases, complications, ang mga elders natin. Letter C, yung lipid or water solubility of the drug. Pag water soluble siya, it can easily be break and it could be absorbed easily. Pag lipid soluble po siya, mas matagal po siya nabi-break at mas nag-i-stay po siya sa stomach. For letter D, potential interactions with other drugs, just like what I have mentioned sa inyo, there are some drugs that may alter absorption pag na-mix siya with high acid fruit juices at ma-mix siya sa milk na nadi-decrease yung absorption such as with antibiotics. When it comes to the review, ayan, re-reviewin natin. This will be the last. Ang reviewin po natin ngayon ay yung absorption. We have the enteral routes at saka parenteral routes. Pag enteral routes po, we have the oral, the buccal, the sublingual, at saka rectal. Pag parenteral routes, it means it is absorbed outside the gastrointestinal tract. So let us start first with oral. Okay, for oral medication, tatandaan lang po natin yung tinatawag nating 2 CASGIP. Just yung 2 colored blue na text po na nakikita ninyo is just a guide for you to remember. Parang mnemonic siya. Why it's 2 CASGIP? 2 C's. Oral medication are usually common, convenient. AS stands for it absorbs slowly. Tapos most of oral route or oral drugs po nagko-cause ng gastric irritation, and letter P ay it is usually intended for pain medications. So 2 CASGIP, common, convenient, absorb slowly, it causes gastric irritation, and it is for pain. If you have any questions po, just put it in the chat box or you may raise your hand or may unmute. Next, if we are talking about buccal, buccal naman po is an indicated route of administration kung hindi talaga siya pwedeng oral. This is very certain lalo na sa may mga cancer kasi 'di ba usually ang mga drugs, yung chemo drugs, nagko-cause ng gastric irritations 'yan. Kaya it may not be the route of administration pag nagma-manage ng pain. Moreover, pag sinabi nating buccal, sigup. What is sigup? Cheeks, between cheeks and gums. Tapos, pH is, it may need high level or optimum level of pH. pH stands for concentration. An example of drug that are identified po for buccal ay fentanyl. Fentanyl is a drug that can manage the pain for cancer patients. Okay? So let's go back. Pag sinabi nating oral, this is 2 CASGIP. Common, convenient, absorb slowly, it causes gastric irritation, and usually for pain medication. For buccal, we have CGUP administered between the cheeks and the gums and may need optimum level of pH. Next, we have the sublingual. Sublingual are being given because ito then ay identified for emergencies. Tandaan lang po natin ang TARBs. TARBs, it means tongue, absorb rapidly. So kabaliktaran ng oral, absorb slowly. Pero pag si sublingual, absorb rapidly, BS in the bloodstream. Okay, TARBs. Ang example po dito is nitroglycerin. If the person is having a chest pain, ang nitroglycerin po ay nagkakos ng dilation of blood vessel. Remember po class, ang person may have chest pain because nagko-constrict ang blood vessels. At pag nag-constrict po ang blood vessels, doon na po madedeprive ng oxygen ang ating pong cardiac muscle cells. Pag na-deprive po ng oxygen ng cardiac muscle cells, doon na po nagmamanifest ang chest pain. So it may need to dilate the blood vessel. At nitroglycerin po is the one that is considered as vasodilator. And it is given under the tongue for emergency situations. At ang under the tongue po natin, ang tongue po natin, pag nagkakaroon ng sores yan, di ba masakit? Tsaka most nagkakos ng bleeding kasi highly vascular, rich in blood vessels. Next, we have rectal. Rectal, ang tandaan lang po natin, is rait. Rait meaning this considers po a concern related po on the insertion of drug, rectum, AIT, absorbed in the intestinal tract. So, an example po dito ay Dulcolax. Familiar kayo, may oral form ang Dulcolax, pero the form that could be suppository ay if it is not managed via oral at contraindicated via oral, binibigay po siya via suppository. So this is a rectal laxative for constipation. Another example, meron din pong paracetamol suppository. Lalo na pagka ang patient po is nagko-convulsion due to fever, meron po tayong paracetamol suppository for pediatric patients. Next, we have naman sa parenteral route. Sa parenteral routes naman, intravenous sa blood vessel, intramuscular muscle. Subcutaneous is we have the tissues, fatty tissues. Then we have otic sa ear, conjunctival sa eyes, nasal, nose, inhalation via lungs, and topical via skin. Pag sinabi po nating intravenous, this is DABs. So ang DABs naman, ang ibig sabihin nito, directly absorb bloodstream at sa vein siya. Directly absorb at the bloodstream. Pag absorb slowly, oral. Absorb rapidly, this refers to sublingual. Direct absorb or access rather, direct access to bloodstream, it's more on intravenous. So yung mga commonly used po for administration are the intravenous for intravenous therapy. Next po is we have the intramuscular. Sa intramuscular po, ang tatandaan lang po natin ay ML, not Mobile Legend, MLHSB3. So ML po stands for muscle, LH, less hazardous. And we have po na ulit, muscle, less hazardous, stays in blood. Okay, stays in blood longer. Stays in blood longer at ang maximum volume that can be tolerated by the muscle ay 3 ml. Never exceed 3 ml for administration in intramuscular because it may cause irritation of the tissues and soon it may cause damage to tissues. Okay? So these are intramuscular. It is not recommended for ventrogluteal and dorsoluteal kasi meron sciatic nerve. And the sciatic nerve is the one na pag na-hit po siya via intramuscular may cause paralysis. An example of drug that are given intramuscularly is the haloperidol. This is an antipsychotic drug. So most sa mga antipsychotic drug, anxiolytic drugs, sa mga anxiety ay binibigay intramuscular para mas longer yung effect. The more that the drug stays in the blood, the longer po ang effect. So that's why it is given intramuscular. Next po, we have subcutaneous tissues. For subcutaneous tissues po, we have FTSM2. So ibig sabihin, the drug is given between fatty tissues, with the fatty tissues between skin and muscles. Kung 3 ml po ang maximum po na binibigay for intramuscular, for the subcutaneous tissues, up to 2 ml. Walang lalagpas sa 2 ml. And minimum of 0.5. Ang pinagkaiba nito, it stays longer pag intramuscular, pag subcutaneous naman, gradual ang absorption. Example of this, example is an insulin. Pag ang insulin po, binigay nyo po sa intramuscular, ang tendency niyan, baka sa pag-stay sa blood longer, magtuloy-tuloy yung pagbaba ng blood sugar. So, hindi pwede. Lalo for intravenous. Pag binigay mong insulin via intravenous, mabilis yan, sudden drop. At ang problema natin, yung pag-cause ng sudden drop ay mag-cause naman ng hypoglycemic shock. So that's why for those who are diabetic at insulin dependent, gradually lang po dapat ang absorption kasi binabalance pa yung at least ma-sustain yung normal level of blood sugar. So that's for insulin. Ang heparin naman po, these are the drugs na ending in rin. Ito ay anticoagulant. Bakit po ito binibigay? These are the drugs that manage to, pag merong bleeding sa blood vessel, nagka-clot kasi yan. Yung clot mismo ay pwedeng mag-obstruct sa blood vessel. So para ma-prevent yung clot, nagbibigay ng anticoagulant. At dapat din po gradual. Why we consider gradual absorption? It's because pwedeng mag-lead naman into bleeding. Okay? So these are the routes of administration. And if we will try to have this projected what we have discussed, nandito yung responsibilities, rights of medication, preparations, and we have also the different forms. Now, this could be the last slide for our synchronous session. Let us connect now the route for administration from time until effect. Kaya tingnan ninyo, yung intravenous po natin, 30 to 60 seconds. Intraosseous is direct to the bone. And sa bone po natin, nandun ang red blood cells. Kaya 30 to 60 seconds lang, may effect na yung gamot. Kasi mabilis mag-reach siya sa plasma. Yung endotracheal naman po is when a tube is inserted, ito po yung nakakonect sa ventilator. The tube is inserted endo inside trachea, nagre-reach siya hanggang trachea. If the drug is being given endotracheal, 2 to 3 minutes po. Kaya di ba minsan may mga nebulization doon na kinoconnect. May mga drug that is being given also endotracheal. 2 to 3 minutes. Inhalation, mga nebulization, anesthesia, 2 to 3 minutes po ang effect. Compared to the sublingual, kasi ano siya, gradual, 3 to 5 minutes. Intramuscular, it stays in the blood, so longer yung effect niya. Kung pain siya, 10 to 20 minutes mamamanage yung pain. For the rectal, it could be 5 to 30 minutes. It varies. Ingestion, ito yung oral, 30 to 90 minutes. Ang tagal, di ba? So, i-compare mo from intravenous to the ingestion via oral. We need to think on how to manage during emergencies. Pag transdermal or topical via skin or patch, it may vary pa kung minutes to hours. It may depend on its effect. Kasi matagal pa bago siya ma-absorb to the plasma. So I think I will end up to this. And I think almost nagwo-work na yung i-start na yung ating self-assessment exercise. So I may stop my recording.